Welcome back, folks, and thanks for staying tuned to Leading Businesses, Leading Communities. Our health and wellness segment, sponsored by Humana, offers a wide range of insurance products and health and wellness solutions for employers and individuals. Humana has learned that people are in better health when they're active and engaged in their social lives, their communities, and families. Humana helps people achieve lifelong well-being by offering products and programs that meet an individual's physical, social, and emotional needs. Northern Kentucky Chamber members receive preferred pricing on Humana's medical, dental, vision, and life products. Contact your health benefits broker for more information or visit humana.com. With me today is Dr. Lynn Sadler with the Northern Kentucky Independent District Health Department. Welcome to the show, Dr. Sadler.
Thank you.
Today we're going to talk about obesity, but very specifically we're going to talk about childhood obesity. And tell us why we should be concerned about that.
Well, first of all, we have a problem because 33% of our children in Kentucky are either overweight or obese. And that's a problem because that can lead to, in children, the same kinds of chronic diseases that we see in adults who are obese, things like diabetes, high blood pressure, high cholesterol, and all of the problems that come from that. Secondly, we know that eating habits and behaviors related to health get established when you're a child. And so whether it's tobacco use or your eating habits or your physical activity that get established as a child carry forward into adults. And children who are overweight or obese are at risk of becoming adults who are overweight or obese.
And why is obesity a problem right now?
Well, actually, it started becoming a real problem in the 1980s, and it has just exponentially grown since then. And that has happened for a variety of reasons. And even though personal responsibility and the choices that we all make have contributed to that, there have also been a lot of changes in our culture and in our society in this country. For example, our lives are very busy and hectic and stressful, and so oftentimes families end up going to fast food places to get food that's relatively inexpensive and quick, and going through drive-thrus. Our technology that's been developed means that we spend more time, unfortunately, sitting in front of TVs or computer screens or gaming systems instead of being physically active.
So what are we doing in Northern Kentucky? Anything to address the obesity problem here?
Actually, there's a lot that's going on in Northern Kentucky, and more needs to be done as well. But we are focusing at the health department on working with community partners, St. Elizabeth Healthcare, the Chamber, schools, and child care centers to implement programs that really focus on getting more physical activity into the lives of our children, as well as how to eat properly and the kinds of foods, getting more fruits and vegetables, doing a lot of work around getting messages out to parents and families and grandparents.
That's great. And before we run out of time, probably about 30 seconds, what can we all do to participate, to try to help this issue?
Well, I think first of all, become educated and understand that obesity is a very complex issue. It's not just a willpower problem. Secondly, whatever you're passionate about, get involved in. Whether if you like green spaces and parks and physical activity outdoors, work with planning commissions to make sure you get those in your communities. And then also make your voice be heard among elected officials, policymakers, school boards, and let them know what changes you want to see.
We can make some changes, and it just takes getting up off the couch and beginning, right? Dr. Sadler, thanks for the information today. Very critical topic. It's one we in business as well as citizens need to all know about and take some action on. Information is available on the screen, and please contact it. We're going to take a short break, and when we come back, we'll wrap up this edition of Leading Businesses, Leading Communities, so don't go away.
My advice to parents to keep their kids healthy is to keep things simple. Eat vegetables and fruits. Get at least 5 servings every day. Set limits on the computer and television. Get 2 or less hours of recreational screen time daily. Play hard and play long. Get at least 1 hour of physical activity every day. Drink milk or water. Kids need 0 sugary drinks. 5210. Healthy numbers for Kentucky families.